Hi, and welcome to the liver, biliary, and pancreas problems chapter. This is a very large chapter that you're going to be spending a lot of time in, especially when it comes to the liver section. So gear up, it's going to be a big section to get through, but you can do it. I believe in you. So this will cover liver problems, biliary, and pancreas. When it comes to liver problems, the first section is about hepatitis. So know the different types. Remember, bowels deal with bowels, right? B has to do with baby, blood, baby making, or booty is how it's spread. And C is more chronic, whether it has to do with alcohol or different things that can cause that kind of chronic hep C. Sometimes chronic also means like chronic hep B, so you can have multiple. So really look at hep A through hep E, know the sources and the route of transmission, and whether or not it's acute versus chronic. Drug and chemical induced liver disease, think alcohol. That is the big one that is kind of present in all of our culture right now. Also think acetaminophen or Tylenol. That's the big drug induced one, or chemical, in other words. Whether we see a lot of overdoses, it could be, hey, I didn't know that my Tylenol PM and my Tylenol, I couldn't take both at the same time, or cough medicine with Tylenol. But really, it's the long-term use of Tylenol that can really cause, or too much Tylenol. Cirrhosis is more the end stage of liver disease, usually due to alcohol intake and viral hepatitis. Look at how does it manifest. There's a bunch of different ways it can manifest, but really pay attention to the complication. Know how those are going to manifest in the nursing care, whether that be portal hypertension, which can cause the big issue of esophageal varices. Know that esophageal varices is deadly. If they start bleeding from those varices, it is very difficult to stop. They have to go in and get them banded. This could be your big health issue, right? The other one is ascites, or hepatic encephalopathy, and hepatorenal syndrome. So really take some time, look at those and look at those complications and know how you're going to care for those complications. And again, reminder, esophageal varices is a big one. The other three that are kind of smaller sections, I want you to read through them, but don't completely dwell on them, is acute liver failure, liver cancer, and liver transplantations. All right, then you get to the pancreas problems. Pancreatitis is a big one. Think pain, pain, pain. These people come in so much pain. Eating makes it worse. They can't position themselves. They are uncomfortable. One of those signs that you can see is Grace-Turner and colon sign. This can be, it looks like bruising. Look at what that looks like. One of the scary ones that can happen with more of Grays is called a retroperitoneal bleed, where they're bleeding actually behind, and that's where they get that flank bruising. And that's something to be concerned about. The two big complications are pseudocyst and abscess. Look at how you're going to care for those. What are the big, think perforation of a abscess that causes, peritonitis, those kind of things. What are you going to look out for? What is your patient going to look like with those? Diagnosis labs, there's some very specific labs of how to diagnose pancreatitis. Think care MPO, right? If eating makes it worse, you don't want them to eat. Eating stimulates the pancreas to produce more enzymes, which then produces more enzymes that are eating the pancreas, basically. So think MPO, PPIs, your proton pump inhibitors. You want these IV, not oral, right? Because you're NPO, no exceptions. You might need an NG tube and management of pain and fluid. Used to be that you would pour a bunch of fluid in these people, hoping to help with the lipase, but now they're finding that you have to have a balance. You don't just pour fluid into them. You need to have the kind of a balance where you don't fluid overload them. It could be a problem if they have congestive heart failure, where you don't want to give them a lot of fluid. So you really have to balance that. This can be chronic. So really look at, this patient comes in, this is definitely chronic pancreatitis. What is the difference from acute pancreatitis? And the final two in the biliary tract is the cholelithiasis and the cholecystitis. Two very hard words to say. Know the difference in how they manifest, and then how you will treat each. And another huge section to look at is how you educate on nutrition therapy with these. A lot of these people need different kind of diets. So how are you going to treat this? Know which one leads into the other. Spend some time in this section really comparing the two. And then the very last bit of the biliary tract is gallbladder cancer. Don't spend a lot of time in here, just read through it. It is extremely rare, but it can happen.